what about the role of epigenetics? I mean, I think that's really exciting because it says that environment makes a difference, that your choices matter. Epigenetics are the modifications to DNA that happen in all of us. Some of them have been inherited from our mothers mainly, through her methylation patterns that you got it when you were an egg. And so the stress that her foremothers had in their lives may affect how your genes are expressed through that epigenetic modification, where you may have the exact same DNA as your twin sister, for example, or your twin brother, but because of your lifestyle that can modify the epigenetics of your DNA, that gene may or may not be expressed the same in both twins. So for example, there's stereotypical epigenetic patterns that happen with smoking or chronic stress that minorities tend to go through, or the poor tend to go through. Chronic stress can make epigenetic modifications like adding methyl groups to certain regions that regulate DNA's expression or how it's used in the cell, how often it's used. These little methyl groups, CH3 groups, can block the machinery that will want to turn that gene on. It can also make the DNA wrap very tightly around little balls called nucleosomes so that the DNA is not really accessible to be used in the cell. So it's called histone acetylation. Histone acetylation controls how tightly wound up the DNA is around those nucleosomes. And so if it's acetylated, it can be closed, and if it's not, it can be more open and more accessible for gene expression. So our environment, our dietary choices, our stresses, our habits can affect our expression of our genes. And in fact, once cancer starts, it actually makes that methylation even more dysregulated and doesn't allow the cell to function properly. So what you do matters. So this is why exercise matters. This is why diet matters. This is why avoiding obesity matters. This is why knowing your family history matters, because it may not always be a gene mutation. It could be a pattern of methylation that's shared because of maybe chronic smoke exposure from secondhand smoke for people who live in the same house. So epigenetics is another way that we're using to predict who will have prostate cancer as well. So someone who works in my lab, his name is Dr. Brian Joyce. He's shared with Dr. Li-Fang Hao here. He's trying to use epigenetic markers, the methylation markers, to predict who will have prostate cancer, have aggressive versions of it.